Hello viewers, thank you for tuning in to Afya Jimudu TV, your health education channel. My good name is Omalai Jogona, a reproductive health specialist. The causes, prevention and treatment of urinary tract infection, commonly known as UTI, in the older children, the youth and the young adults. In this population, the causes that were there in early childhood, that is contamination by stool, which is usually without bacterial infection, still remains for various reasons. Because there are those who had recurrent UTIs which were not treated promptly. So the urethra was damaged, and therefore the probability of them getting an infection in the future, chances are usually very high. So there is contamination by stool, and there is also an injured urethra due to recurrent UTIs in early childhood. So the problem might be carried on into adulthood or in older children. The other reason why they might be getting UTI is because there is now the sexually transmitted infections. We cannot be able to tell exactly when these children acquire these sexually transmitted infections, because now it will depend on where these children are spending their time and how they are being brought up. We look at the causes of UTI in the older children and the youth, including the young adults or the middle age group. Cause number one, just like in the early childhood, it will come from bacteria that usually colonizes the gut, and it will appear there as normal flora or commensals, which usually may be a cause of a disease in the gut, or might just be there present without there being the presence of a disease. And these bacteria will include the group of the Klebsiella, we have the Proteus species, we have the Pseudomonas species, we have also the E. coli. But now we have to include the presence of STIs, that is the sexually transmitted infections, as a cause of UTIs. Not forgetting also that there are other diseases that usually infect the skin, or they appear as normal flora or commensals on our skin, since we are not without, or we are not free from bacteria. So when there is a breakage of the skin, usually near the genital tract, then they might find their way into the urinary tract, thereby bringing about the urinary tract infection. And it is good to have a picture or get to know the group of STIs that is usually associated with the UTI. Remember that you can acquire them, or they can be acquired sexually through sexual transmission by way of having sexual intercourse, or they can be transmitted from one person to the other by way of contamination. That is, maybe there is this person who is watching the children, and at one time he or she had touched his or her genitalia, which is infected, and when they are washing these older children, or when they are enjoying having pleasure, and maybe there was not intercourse, but they got their fingers, which are infected, to touch the genitalia of the other person, then the infection can be transmitted. And these bacteria largely are, we have gonorrhea, we have chlamydia, and we also have the Mycoplasma genitalia. And remember, these infections are the ones that make it very easy for one to acquire HIV infection in future. The prevention of UTI, that is the urinary tract infection, in the older children, the youth, and the middle age group or the young adults. Remember, it is good and always, while opening the bowels, to clean yourself from forwards going backwards. This way, you will prevent the stool contaminating or coming into contact with the genitalia. Number 2, for the older children, it is always good to get them to know. You can get to teach them how to, because if it is not done appropriately or you make an assumption, then if the UTIs become repetitive, then the urethra will become injured, and therefore in the future this child will become an adult, will regularly be visiting the hospital for the treatment of the UTI, which will be stubborn and seemingly will not be going away, and might bring about mental illness owing to stress. The other thing, it is good, and let me say sometimes we get worried as to whether we should get to wash our hands before going to the toilet. Remember, these bacteria that bring about STIs are very contagious or highly contagious, and they are very aggressive. Sometimes maybe by shaking hands, touching everywhere where everybody else has been touching, you might carry these infections in your hands. And that's why we encourage people, the moment you get into your house, to wash your hands, so that other bacteria that were initially known to bring about the vomiting and the diarrhea or abdominal problems, we could also be transmitting or bringing to our families even sexually transmitted infections by way of not washing our hands. So sometimes I wonder whether we should wash our hands even before visiting the toilet, and to include after leaving the toilet, because when you are going to the toilet, you assume that you are clean, and you are not clean when you are leaving the toilet. You could be carrying germs which you are about to transmit or contaminate your genitals, and you might be living with an STI. And that's why many people will say that they acquired the infection from the contaminated toilet, and which is usually not the case. The place does not open for the contents in the toilet to enter. No, it is the contents that leave your body that will enter the toilet. Unless you are dipping your wipe into the toilet to clean yourself, it should not be the other way around. So the other thing is that it is good for the youth and the older children to be taught on a proper usage of condoms, and to abstain from sex so as to avoid acquiring these infections which will bring about UTI. And sometimes treating them can prove to be very difficult, because these bacteria are becoming very resistant to treatment. And sometimes when you present to the hospital with a UTI, it is treated like the bacteria, or they ought to think that the cause is the bacteria that usually colonizes the gut, not knowing the bacteria now that is causing or bringing about the problem is the one that is known to bring about the STIs. The other thing to consider is the timely and prompt treatment of probable skin infections, especially when they are around the genitalia. If the disease or the skin condition progresses, it might bring about a UTI, that is the urinary tract infection. It is also important to consider taking a lot of fluids, that is water, not so much, just enough to make you be able to pass urine 3 times in a day, because then the urine will not be so acidic as to injure the urethra or cause a disease or progression or worsen a condition whereby there was a UTI. Because if the urine is so much acidic, then the healing of the urethra and the repair of the mucosal membrane that prevents the injury of the urethra, it becomes impaired, since you are not taking in a lot of water. Remember also, it is good to deworm regularly, because some of these worms, especially pinworms, will bring about itching around the anal region, and when your hands spend most of their times there, chances are also there that you might be transmitting the infection to the genital tract, thereby bringing about urinary tract infection. Now we shall move on to the treatment of UTI in the older children above 5 years, the youth, the middle-aged, or the young adults. Before we move on to the treatment for UTI, it is good to have a picture of the signs and symptoms of a urinary tract infection. The commonest is pain or a burning sensation when you are passing urine. It is good to note that not all patients with a urinary tract infection will have these signs or symptoms. The other sign could be pain of the lower abdomen, especially just around or above the symphysis pubis, or the pubic region. So if there is pain there, it could also be a sign of an ascending or a climbing urinary tract infection. And again, remember, not all patients with UTI will have signs and symptoms. The other sign or symptom could be pain of the flanks of the abdomen, be it on one side, left or right, or both sides. That could be an indication of a climbing or an ascending infection which found its way through your urethra, your bladder, and it is now climbing to either one side of the ureter or both ureters, and the pain might be felt on the flanks of your abdomen. So remember again, not all patients will have the signs and symptoms of UTI. So some might go without noticing that they have, or feeling that they have pain on their flanks. The infection might ascend and climb further and find their way into the kidneys. These patients, if they tend to have the signs and symptoms, then they will have a backache that is usually presenting just below the ribs at the back. That is the middle back pain. Could be on one side or both sides. That means that the kidneys are now getting involved from an infection which could have found its way to the kidneys from the blood circulation that is above the kidneys, or through an ascending or a climbing infection from the urethra, the bladder, the ureters, and into the kidneys. So it is not good to miss this sign. And being without a sign nor symptoms does not mean that you are not without an infection. So how do we go about ruling out an infection? We have investigations. They could be radiological or laboratory. Some of these tests are very affordable. We have the urine analysis, which is also known as urinalysis. It can be able to tell whether there are signs of a bacterial infection, or whether the kidneys are already damaged, or the urine pathway is already damaged. And sometimes, there being no sign of bacterial infection does not rule out the possibility of a urinary tract infection or a sexually transmitted infection, especially so in men, because these bacteria are also surviving. Sometimes we humans tend to think that we are the only intelligent living beings. These organisms are alive, and they are not our enemies. They are also trying to exist. So they find their way into the prostate gland, where there is seminal fluid which will be nourishing them just like the sperms. So they'll avoid the pathway whereby they are being washed down by the urine frequently. So usually semen analysis has been a reserve of the fertility clinic. So it's only men in the fertility clinic that are being subjected to semen analysis. Also, the other population, if you want to find out whether you have an infection of the seminal fluid and the prostate thereby, then you ought to have a semen analysis. Remember, cervical cancer has been known to be caused, and it has been confirmed, it has been demonstrated that it is a sexually transmitted disease. And the cervix is part of the uterus. In men, we do not have the cervix nor the uterus. We have the prostate gland, which is equal to the uterus and the cervix in women or ladies and girls. So even the men are likely to develop prostate cancer being brought about by sexually transmitted infections that go about being noticed nor treated, since the prostate gland, usually because there are no pressures around that region, then the pain will not be felt, since there is a lot or plenty of room in the abdomen. So these infections in men are missed. So the neglection of the boy child, we can see it again happening in the medical field or the medical world. Okay, so that's how we go about the urinalysis, and I've brought about the idea of semen analysis even in young men and older men who are known otherwise not to have fertility problems by way of treating UTIs. So the other test is the ultrasound. It is not invasive. It is also affordable. It will tell whether there is swelling or inflammation of the bladder, urinary bladder, and also the kidneys, and also signs of kidney stones which could initially be missed by the urinalysis. It could be indicated by, or it could be identified by the ultrasound. So those are the basic tests which will show or tell whether there are signs of urinary tract infection. Remember, at the hospital, we do not treat laboratory reports. We treat the patient. So even your history has a lot to tell. So the first investigation is the report that, or the history that you are giving. Number two is the investigations that we shall be conducting to prevent future infections of the urinary tract. It is good to have your random blood sugars checked, especially nowadays we go to the age of 30 years and above, because we rarely exercise nowadays and we are not eating healthy. Because if you develop diabetes mellitus, especially type 2 in the adults, then it will make you acquire these urinary tract infections more frequently and easily. The other thing is, it is also good to have yourself being monitored, that is the blood pressure, because again the kidneys might be damaged by the high blood pressure. It is also good to take plenty of fluids to keep the urinary tract being flushed out more frequently, and to avoid the bacteria resting or settling down in your urinary tract. The other thing is good to abstain, have one partner, or use a condom, since these infections are very stubborn. That is the STIs, they are resistant to treatment, and most of the drugs that are being stocked by pharmacists are counterfeit, and they are being sold cheap, and you might be tempted to buy the cheaper ones which are counterfeit. and the disease will progress, bringing about complications, and sometimes with all the money you cannot be able to cure the disease, since it could have resulted even to the kidney failure. Now we move on to the treatment for the UTI in the older children and adults. Remember, we had earlier mentioned that UTI is brought about by microorganisms or the bacteria that could either be affecting the skin or infecting the skin, and also by contamination by the bacteria that is usually found in stool. And also we are bringing about into the picture the presence of the sexually transmitted infection, that is the gonorrhea, chlamydia, and the mycoplasma genitalium. So for the treatment, here it is quite confidential, and what you are going to get in your prescription is not usually in a bad handwriting, and it can always be kept for future reference. And it is always good to seek to get your drugs from a reputable or a reliable pharmacist, since then they can help you calculate the dosage according to the weight, and also the chances of you getting counterfeit drugs are minimized. So to get the prescription, you can get to pay 200 Kenya shillings via M-Pesa, pay bill number 4069725. Account number is U.T.I. So the prescription, you get it in a way that you can be able to read, and for future reference. Remember, it is also good to tell whether or discuss with your pharmacist whether you are allergic to any of the drugs. And it is always good to complete your medication. If you are sexually active, it is good to bring about your partner for treatment, since it's the only way we can rule out the possibility that the UTI is an STI. Remember, sometimes doing a culture and sensitivity to rule out whether it is an STI and or whether it is the common UTI, it can prove very difficult, since it is expensive, time consuming, and sometimes we cannot be able to tell exactly, because if you are going to be tested for chlamydia, we have tests that are called the antibody test. So we cannot be able to tell exactly, okay, IgM and IgG, now we cannot be, when did you acquire this infection, even after treatment, how soon do you expect it to go away? So sometimes these tests are not reliable, and that's why we are saying we do not treat laboratory reports, we treat the patient. Thank you. Please remember to subscribe, comment, and share. See you in our next educative health shows.